If you're living with fibromyalgia, you've probably heard that exercise is crucial. Yet you might find yourself struggling to get started. I've seen hundreds, maybe even thousands of people with fibromyalgia and have heard all the reasons why someone doesn't get started. Perhaps it's the worry of causing a flare or feeling silly because you can't do what you used to be able to do. Or maybe you never really had an exercise routine in the first place, and now with the pain of fibro, it just seems like that ship has sailed. Well, today I'm going to talk about how, yes, what you've heard is true. Exercise is crucial for fibromyalgia. I'll discuss why it's so important and how you can actually get started. I'm Dr. Elizabeth Ortiz, and this is Connected Rheumatology. Let's get started. Fibromyalgia is a condition characterized by chronic diffuse pain and multiple somatic symptoms. It is a type of pain that we continue to learn a lot about and even have a new classification for it called nociplastic pain. Nociplastic pain is pain that is the result of nervous system dysfunction and hypersensitivity. If you want to learn more about it, you can check out this video on the pain of fibromyalgia, and the link will be in the description. This type of pain is challenging to assess in the clinic as it's not the result of any tissue damage or inflammation that we can see in our blood test or on physical exam. Right now, pharmaceutical treatment options for fibromyalgia are limited. There are currently only 3 FDA-approved medications for fibro: duloxetine, pregabalin, and milnacipran. Other medications are used off-label and may be brought up by your doctor, but it depends on your doctor's experience and their comfort level. These medications, however, don't fully alleviate pain for most people. And it's because of these limited pharmaceutical options that, in an attempt to find things that actually work, researchers have gone back to the basics and studied how things like exercise can impact fibro. Now, a common misconception is that exercise worsens fibromyalgia pain, but the research shows exactly the opposite. Exercise positively affects fibromyalgia in many different ways. It can decrease pain, decrease depression, and improve quality of life. All things I know every fibromyalgia patient wants. When it comes to researching lifestyle factors and their impact on disease, it's very easy for the science to get muddy. These types of studies aren't done in sterile labs where every variable can be controlled, and so it's always easy to look at a study investigating something like diet or exercise and poke holes in it for not being perfect. One method to get around that is to just have a large volume of studies all pointing the same direction. And that's what we have with movement and fibromyalgia. Even though each particular study is slightly different and probably only has a small group of people and may show slightly different results, the vast majority all say the same thing: movement is good. But how do you actually start a movement routine? Well, the first step is acknowledging how your body has changed and not beat yourself up about it. Your body isn't the same as it was before, and so you will need to approach movement differently. Start slow. Now, I know we all hear this a lot and think, yeah, slow. No, but really, start slow. Slower than you want, slower than you think you may need. This might mean a walk around the block, 10 minutes on a stationary bike, or a gentle yoga class. I would recommend avoiding high-impact activities initially. Gentle yoga and water therapy are great. I have especially seen people get a lot of benefit from getting in the water, whether it's swimming or water aerobics. Walking, even on a treadmill, is effective, although walking outdoors offers the additional benefits of connecting with nature and getting sunlight, both of which calm the nervous system. Simply putting it on the calendar and following through is a win. Honestly, this is about building a new habit, which takes time, so no need to try to sprint to any finish line. Wherever you are starting, only aim to increase it by 10%. As you get started, you are going to want to pay attention to your body. In the beginning, it can be hard to discern typical fibromyalgia pain from pain that requires attention. While you might trigger a minor flare-up, this is a trial and error process. Remember, fibromyalgia is life-changing, but it's not life-threatening. The risk of seriously damaging your body or causing irreversible harm is very low, especially when you're starting slow. So listen to your body and avoid overdoing it, but keep at it. Anytime you're trying something new, learning a new skill or building a new habit, getting help increases your chances of success. Help can be from a friend, a physical therapist, or even a personal trainer. Having a friend to exercise with can make the process more enjoyable and help you stay committed. I've seen many people get shy about asking a friend, especially if they feel the movement they're doing is weak. I would encourage you to ask anyways. If they care about you, they'll consider any excuse to hang out and help you reach a goal. You may also consider getting help from a professional, like a physical therapist or a personal trainer. I'm bringing up both because I honestly believe that depending on the person you find, you can get help from either. But it is important to know, however, the difference between the two. Physical therapists are healthcare professionals who specialize in helping people maintain mobility and function in their body. They can diagnose physical limitations and create plans that involve strengthening, stretching, and mobility work to improve the limitation that they see. It's important, however, to find a PT who has experience in fibromyalgia. Many PTs work with joint replacements, sports injuries, or serious neurologic disabilities. But the approach to all of these situations is very different than what someone with fibromyalgia needs. When looking for a new physical therapist, always ask what their specialty is and what their experience with fibromyalgia is. As much as I'm a fan of getting help and starting slow, I have seen many people come back defeated and honestly kind of mad at me for recommending PT, as the wrong PT can definitely push you too hard. When you get a new joint, the type of exercise you need is going to be very different from when you have fibro and are just getting started. And I also want to say a word on personal trainers. We may not necessarily think personal trainers are going to be the best professional to help with fibromyalgia, and honestly, that's probably true. But I am well aware of how hard it can be to find anyone with experience with fibromyalgia, and I wouldn't shut yourself off to some potential help just because they don't happen to have the right credentials. Personal trainers are different from physical therapists in that there is no standardized education and training. Physical therapists go through a standardized education and training curriculum, and although you will definitely find interpersonal differences, they all come from the same education. This is not the case with personal trainers. There is no standardized training, and there are lots of different certifications out there. It's hard to know what's what. But if you find someone who's knowledgeable about fibro, you get along with, and helps you stay motivated to keep moving, I'm not going to judge if they're a personal trainer versus a physical therapist. So now that you've started, how can we make sure that you keep going? I've always found that keeping an eye on the big picture, that movement is fibromyalgia treatment. That movement is retraining your nervous system so it better regulates and then your pain is decreased. Keeping your eye on the big picture while then looking at the small thing you can do today is the way to keep the ball moving. And although personally I have a love-hate relationship with all these trackers that have come out, I can't deny that they can be great at keeping the big picture clear while also motivating to do something today. So whatever is your app of choice, I would recommend looking into something that can give you objective data. And I stress objective because I know all too well how easy it is for us to misremember. Oh, I've only taken a few days off of my usual walks, and then I go and look at my data and nope, it's been 2 weeks. Crap. Starting a movement routine when you have fibromyalgia is a great way to start to rebuild trust in your body. I've had many patients astutely tell me how they feel betrayed by their own body when they get a diagnosis of fibro. We no longer understand what's going on or trust it, and that can make starting any kind of physical routine scary. But I want to encourage you that you can rebuild that trust. Not only does the research show this, but I have seen it in my clinic time and time again. By showing up for themselves consistently, starting slow and tracking progress, I've seen people who used to need to see me every month taper off to every 6 months, and even then, it's to talk about coming off medications. I hope you found this helpful. If you did, please like, subscribe, and share this with anyone you think could use this information. If you want to learn more about nociplastic pain, check out the video on the pain of fibromyalgia, and I'll see you next time.